All right, welcome back, everybody. If you've seen me walk, you know I do so kind of gingerly. That's because I have foot pain, and I've had foot pain most of my life. So when they asked me to go to Comprehensive Orthopaedics in Cheshire to talk all about my feet, I jumped at the opportunity.
Did they find anything?
Oh, yeah. I met up with Dr. Adam Ferguson, and he told me all about my feet and what can be done with them. Take a look.
You're looking at my feet. I know, not everybody's a fan of feet, but the reason I'm showing them to you, they need help. They hurt just about all the time. I was born with bilateral club feet, and while I had an excellent doctor at birth who corrected the problem, I've had pain along the way. So I decided to pay a visit to Comprehensive Orthopaedics in Cheshire. That's where I met up with Dr. Adam Quinn Ferguson. First, a little bit about Comprehensive Orthopaedics. They have 4 locations.
We're a group of 9 orthopedic surgeons and interventional pain docs. We are here we're in Cheshire today. We have Wallingford, we have Meriden, we have Southington as our other offices. We cover kind of all gamuts of orthopedics. You know, we're a community-based group. The group has been around for about 40 years. I have obviously not been around for that entire duration of time.
I would have guessed 22. 22 years old.
22 years old, close enough.
Okay, good.
But the group has been around for 40 years. We handle everything from backs, hips, knees, shoulders, elbows, wrists, foot and ankle. Anything that ails you, any problems you have, we can definitely take care of it.
Dr. Ferguson is an orthopedic foot and ankle surgeon.
My fellowship was in foot and ankle. That's kind of what I'm passionate about, what I really enjoy. I would say probably 70% of the patients I see on a daily basis are foot and ankle specific patients.
Now, surgery isn't the only answer if you've got problems with your feet.
A lot of times it's not surgical. So a lot of things we do, conservative options, we use medicines. The common medications that we use usually fall in the NSAID or non-steroidal anti-inflammatory drug category. So that's your over-the-counter ibuprofen or Aleve. There's prescription equivalents or essentially cousins of the same medicine, and those can be very helpful with any sort of either acute or chronic ankle pain or ankle issue. They help with swelling. And that's kind of, that is one of the starting points for any sort of ankle or foot pain.
And then the next step would be, if that didn't work?
Therapy is a kind of tried and true. It works, it's effective, it's been around for a long time because it is effective.
Physical therapy.
Physical therapy.
There are also certain braces the doctor recommends, and if they don't work, it may be time for surgery. The doctor can do full ankle replacements if necessary.
Then we turn our conversation to what's the surgical option for you, what's your recovery expectation, you know, out of work time, all those, and how do we get you back to where you want to be?
Well, as Carly Simon sang, I haven't got time for the pain. So I let Sue, the x-ray technician, get an up-close and personal of my feet, and then it was on to Dr. Ferguson for a look-see.
So the biggest things I look at on any x-ray is I'm looking for, especially the feet, I'm looking at alignment, and then I'm looking for presence of arthritis. Those are the two kind of 1 and 2 that I check on everybody. You know, if there's concern for a fracture, you obviously check for that. You check for that kind of empirically.
First of all, the doctor tells me he sees very flat feet, and
You have arthritis on both, but it's just worse on the right.
It's worse on the right?
Yeah.
Yeah, okay.
Mike, I would, notably worse on the right. Not concerning, like, oh my gosh, amount, but.
And how does that form? How does that happen?
In your
Just
case, I
age?
think it's almost exclusively because of the club foot.
Because of the club feet.
Yeah, your mechanics were never totally what we would call normal. So because of that,
say that again.
Your mechanics,
my
your foot mechanics were never 100% normal, just because of how you were born. I mean, you've obviously gotten this far with limited issues with it, but the mechanics throw off the joint forces, which cause excessive wear and tear in some spots, and that's what causes arthritis.
it's not all bad news, though.
Your ankle looks fine, like your ankle joint, so you're not a replacement person. But if you have a lot of pain right there, kind of right below your ankle.
That's exactly where it is.
Yeah, then you can just take and put a couple of screws in there and fuse that together, and then that pain goes away. You have to be off of it for a while.
Dr. Ferguson then shows us an example of a patient that has a much bigger issue. They're going to need that total ankle replacement.
So what we have here is a pretty classic picture of tibial talar ankle arthritis. So the talus and the tibia are here, and what I'm looking at when I look at an x-ray is I want to see any joint space between these two bones, and as it's clear to me, maybe not as clear to our regular viewers, but there's no space left here. You can see this bone is directly abutting this bone, which means to me, because this is a weight-bearing or standing x-ray, that there's no cartilage left in there. So this patient's completely eroded through what cartilage she was born with. Part of that is because she has an old fracture here. So she broke her fibula, or the smaller partial or non-weight-bearing bone on the outside part of the ankle. And while it healed a little bit out of where it would normally be, and so that caused a little bit of a shift in the mechanics of the ankle and caused her to break down the cartilage that was once healthy and now is causing her pain and causing her discomfort.
This patient is now scheduled for surgery with Dr. Ferguson at Comprehensive Orthopaedics.
Nice to meet you.
Appreciate your
It
time.
was a pleasure. I appreciate your time.
Let me just tell you one thing. Dr. Ferguson, what a nice guy. I would totally trust him with my feet. And remember, they do more than feet. If you would like more information about Comprehensive Orthopaedics and their 4 locations, head to comprehensiveorthopaedics.com.
Yeah, so important. Sometimes you can just go straight to the orthopedic and save time rather than
Exactly.
going to and getting all these referrals.
Right.
You go straight to them.
And such a nice guy.
Yeah.
Oh my gosh.
Well, I hope you got your feet fixed.
Yeah.
Yeah. All right, get ahead. Still ahead, I should say. Get ready for your sugar rush.
All right.
Have you heard of Luann's Bakery in Ellington? They're amazing. They're gearing up for another fun year at the Big E. We're going to get a little sneak peek of these specialty...
A sneak view.
A sneak view. They even have pickle cupcakes.
Oh. Plus, school is back in session, but what kind of classroom parent are you? We're chatting all about the pros and cons of volunteering in the classroom with our friend and mom, Anna Zapp, right after this
I saw
break.
this one. It's hysterical.
All right, stay with us. We'll be right back.